Hello and welcome back to Infection Control and Standard 15, which is your final standard in the care certificate. So if you've made it this far through, well done, final hurdle. So let's look at infection control and why this is important for us. Well, infectious diseases attack our immune system. There are particular vulnerable groups within health and social care in which if we get an infection, it can make us more sick, such as the elderly, the young and people with low immune systems, maybe people with HIV or cancer treatments. Therefore, it's important we provide a safe environment where we stop the spread of infection and we try to reduce things to a safe level. Infectious diseases can also come about and cause health complications. They can trigger things such as seizures, strokes, cardiac arrests, etc. So it's important we work alongside them. Pathogens sometimes cause disease as well, and they fall into different areas. So we can have bacteria, and bacteria can multiply quite quickly across the body. So you can start off with one cell, it doubles and doubles and doubles, and within 20 minutes you can take one cell to 3 million, and that will fit on a pinhead. We have Staphylococcus aureus, which is the bacteria in our hair, Listridium perfringens across our face, we have MRSA in our nose. So we are filled with bacteria anyway as living organisms. Our bacteria isn't harmful to us and our family, but it could be harmful to other people with low immune systems. So it's important that we realise that. In 2007, the last data that they received, nearly 9,000 deaths were caused through bacteria and pathogens. And again, poor food hygiene can contribute to bacteria. Now, viruses. Viruses can survive on direct or indirect contact areas. They can multiply and they can live on things. They can live for quite a long period of time on hard surfaces, and unlike bacteria, they won't die as quickly, and viruses are a lot harder to keep under control. It's important, therefore, that we ensure we follow really strict infection control procedures when there's a virus. It's important that we look after our own immune system, and again, annually when the flu shot comes around, that we think about immunisation for ourselves to try and keep viruses to a safe level. Because viruses are highly infectious and they can spread quickly, the ones in which worry us mostly each year is the flu and norovirus. Norovirus are symptoms of diarrhoea and vomiting, and again we know the food and influenza will be things like heavy colds and they affect the respiratory system. So good hand hygiene is essential in tackling viruses. We have fungi, which are organisms that live on a host, and again they can look a bit like rashes and skin peeling and athlete's feet. So fungi and funguses normally are quite infectious and they can be spread via direct contact or transmission through indirect contact. And if you think about swimming pools, you used to have the water things where you could clean your feet in because of the chlorine. And again, it's important that we try and manage skin conditions ourselves. So if we know that we have a fungi or a fungus infection, we need to be treating it with the creams and steroid creams to reduce the infection onto other people. Moving on to parasites, unfortunately we seem to have a lot of parasites kicking around in the care service, even more so in the areas of domiciliary, and they can be things such as bed bugs and body lice and crabs and head lice. So it's important we maintain good personal hygiene, but also good environmental hygiene as well. And then finally, we have other viruses around single cell organisms where if it's wet, it can create kind of mould, and again, you have that effect and it can smell. Now we know most organisms need a host. So in other words, they need something to live. And we have what's called the chain of infection. So we start off with the agent, it has the source, it has a way to exist, it has a mode of transmission, it has a way into the body, so absorption, ears, nose, eyes, or injection, and then people at risk. So again, for us to reduce things to a safe level, we need to break the chain of infection. We need to try and reduce the agents as well. So any harmful germs or pathogens, infectious diseases, we need to be able to try and reduce those. So that could be other things in which we can do to remove that. So it would be things around managing the host, removing kind of puddles of water, maybe stop the build-up of food, and making sure we're storing food at the correct temperature. Again, animals can have Clostridium bacteria on their feet and paws because they're bringing mud from the outside, and again, that can be harmful to people. It's important we think about the means of exit. So how will the pathogens leave the source? And here, it can leave through the respiratory tract, through the throat, etc. And again, it can leave through saliva or moisture through the body. So if we cough or we sneeze, if it's cooking inside the lungs, we can spread it that way. So good respiratory hygiene is really important when dealing with respiratory problems. So if we cough or sneeze, we should put it into a tissue, bin it and wash our hands. And if we haven't got anything to hand, we should go for the shoulder and sneeze and cough into our arms. If we can think about the fourth thing, the mode of transmission, stopping the passages from passing on from one to another, we can do that by good hand washing or decontaminating, cleaning and sterilising areas so it doesn't carry on. It's important that you think about how pathogens can enter into the body. So if we can limit touching people, shaking hands and things like that, we have an opportunity to reduce the infection. And finally, we need to look at the people at risk. So it's important we identify who's at risk and isolate them and protect them from the vulnerability of any virus or bacteria. We need to break the chain. That's what this is all about. How can we do that? Good hygiene, good control around waste management, good management of laundry and personal care. So again, we're getting close to the right temperature, or we're using detergents that have the certain gels in them to reduce your laundry to a safe level. And again, the correct use of PPE. Within your workplace, you will have certain policies and procedures around how to deal with contaminants and how to deal with things. And again, you should follow your infectious control policies. Your health is your hygiene. It's important that you maintain your own immune system and you maintain your own personal hygiene. Washing your hands before and after tasks, avoid touching your face, and again, if you're touching anything for bodily fluids, you're wearing gloves and aprons. If you're not well, report symptoms and deal with them. Clothing needs to be tight to the body. We shouldn't have clothing that's loose that can spread over worktops because the pathogens and bacteria will run through you quickly. It's useful that when working in health and social care, you wear normal, sensible clothes. You're not going to a fashion parade. You don't need to wear pretty stuff. You can wear polo tops that are a couple of pounds and solid trousers. All of these can go in a washing machine and they hit high temperatures, meaning that you can do your bit to reduce infection. If you're wearing fluffy clothes, if you're wearing fluffy cardigans, it's going to pick it all up and you're just going to be a transmitter. So try to reduce it. Again, personal hygiene really important. We need to be there below elbows, because when we wash our hands, if we've got jewellery or bracelets on, the bacteria is going to get caught up in there, and again, we're not going to clean our hands properly. Our hair should be tied back. If we have long hair, male or female, it should be up in a bun. Ponytails are no good because when we move our hair around, we're flicking bacteria all over the place, and it should be secure to our head. Equally, we know we have Staphylococcus aureus and the other bacteria in our hair and face that we're just retransmitting. So keep it nice and tight. Fingernails should be short. I have absolutely no idea why anybody would want long fingernails in care. A, it will be painful if you crack them and you press pressure. B, if you're wearing fake nails and somebody pulls that back, it could pull off your original nail with it. And also they become a mode of transmission. So the bacteria can sit under the nail and in the glue and the plastic, the shellacs and acrylics between the nail and the finger. We need to make sure that we're daily washing. So this is morning and night. So before we're leaving the house, let's have a wash and a shower. And when we get home, let's jump in the shower straight away and let's not pass the bacteria from the outside world to our family. It's important we maintain our own skin, so we should be looking at our skin. If we smell, there's a concern there. It means the bacteria is kind of warming up and you can smell things, and that's a sign that you need to wash. Again, you may have itchy skin, so if you've got rashes, look at your skin and think about it. Maybe you need to apply some steroid creams, or maybe you need to start thinking about skincare. Remember, when we're washing our hands all the time, our hands become dry and cracked. If we've got cracked skin, that's a mode of transmission into our body and a way in which we can become unwell. It's important you maintain good hand hygiene and making sure that your skin is in good contact. You need to form good habits. It is obvious to me when I go out to observe care that people do or do not have good habits. Good habits happen naturally. You'll wash your hands naturally, you'll put your gloves and aprons on naturally, and you don't have to think about it. So it is obvious when people are not doing it. Competency is really important. You must know how to wash your hands in both methods. You must know how to use the wet and water, and you must know how to use the sanitizer gels. Please, please, please remember, hand washing with soap and water is more effective than the alcohol gels. We should be washing our hands at least every 20 minutes within the care service to try and keep infection down. We've covered this before, but again, we'll cover it again. So when we wash our hands, we put the water and soap in, we lather up, and we're going to go in between our hands. We're going to do the knuckle shuffles, we're going to go round the thumbs, and then we go round the wrists. So that whole process should take about 20 seconds. You'll be given PPE to help protect you at work. So that will be things such as gloves, aprons, and if there are infectious diseases going around, we're doing barrier nursing, maybe face masks as well. Goggles may be necessary if somebody is known to spit in their saliva, because we don't want saliva going in our eyes either. Then we need to think about our waste. So when we take our gloves and apron off, here you can see that we fold our gloves into each other. We don't leave them as separate, they go into each other. Again, our aprons, we can take those off, we can hold them in our hands, and we can pull the gloves over the whole apron, keeping the infection inside the apron and the gloves. It's important you follow the clinical waste procedures with PPE and understand your policies, so please take time to read them. If you're using sharp items, such as you're doing blood samples for diabetes, please make sure you understand about sharps and that they go into the yellow bin. Never resheath the shaft, so never put the needle back into something, because if you stab yourself, you're going to infect yourself through a needle stick injury. They then need to be reported, you'll need to cut and bleed yourself, and you'll need to get yourself over to A&E to get some treatment to deal with any infections that you may have contaminated. Don't leave your bins over full, don't put your hands in a sharp bin, and pay proper attention when you're doing any needle work. Although you shouldn't be doing any syringes anyway. Soiled linen. It's important that we decontaminate soiled linen, that we're always wearing PPE, that we don't leave dirty laundry on the floor, and then it's going to go straight into bin. Ideally, we should be washing at a high temperature, the higher the better. We know if we can get it above 65 degrees, we start to kill bacteria more. However, if we are going at normal temperatures, we need to make sure that we are putting in chemicals to help reduce any bacteria on there. The reason we tumble dry clothes and iron clothes is because only when we start tumble drying and ironing do we get the temperature up to a safe level to kill bacteria. So ironing is fundamentally one of the most important processes in cleaning clothes, because it removes and steams and cleans any viruses or bacteria on the clothes. Bed towels and that should be washed separately again, and we just need to think about what we're doing when we're in people's homes. So, agreed ways of working are our policies and procedures, basic infection control processes, and following good codes of practice. You'll know all of those because you will have done your training, and again, there are separate infection control modules in which you need to do further down the line. So let's look at some of the knowledge requirements you need to now finish your care certificate and complete Standard 15. So, here, in order to prevent the spread of infection, we need to know how to deal with harmful organisms and pathogens. This can be done. Describe three ways on how an infection can get into the body. So again, here we just need to list 3 ways in. Here we're going to look at and explain. So we're looking at how pathogens and hosts are managed and how workers have good personal hand hygiene. Think about someone you support and 3 examples of how your own health or hygiene may pose a risk on them. So think about you and how you may pass things on to them if you're ill, with your clothing, with your personal hygiene, with any skin and with any hand hygiene issues. We'll move on to what the law says about PPE, and again protecting people from injury as far as reasonably possible by conducting and reducing the risk of infection. So here, complete the table, think 5 examples of types of personal protective equipment, what they are and how and why you use them. For example, I would use gloves when dealing with soiled linen. Here, we're going to handle infectious waste and use the agreed way to work in it, explain how to deal with soiled linen in a safe way. Now the reality is you can only talk about in people's homes, so hopefully you'll have your linen basket and you won't be throwing it on the floor and contaminating the floor. So what is you're going to do and how will that help with the spread of infections. So that's the end of the workbook. As I've said, you're going to do your other training on top of this, which is the more in-depth one. This is the one to get you started. It's important that you take responsibility for your own health and well-being. The reality is one person can infect 14 other people. So we need to work really hard about maintaining our own personal hygiene and being aware of our own habits. Avoid touching your face, avoid touching your mouth, and again, before and after every task, please wash and dry your hands properly. I wish you all the best of luck in your career in health and social care. Thank you for choosing such a valuable job as your career, and I wish you all the success in moving forward and undertaking any further training. Your tutor will now mark this and hopefully give you your final feedback, and on completion you'll have to attend your competency skills, so that's where the standards are checked off and your competencies are marked, and on successful completion of that you'll be awarded your certificate and badge. Thanks for watching, and I wish you all the best in the future.